Start. Today we are presenting a case of bright unilateral echogenic lung. You can see here, this is the stomach, this is the left side of fetus, and this is the right side of fetus. This is the gallbladder and these are the lungs. Now as we proceed toward the heart, you will see these are the bright echogenic lungs. You can see clearly the left lungs are enlarged and these are brightly echogenic. The size is approximately 3.5 into 3 centimeter. Now you can see here that the lung is shifted toward the right side of the thoracic cavity. The cardiac circumference and the thoracic circumference, the ratio we take, that is the CTCR, which is approximately 0.5, but in this case you can see here, as we take the cardiac circumference and the thoracic circumference, the ratio is reduced. You can see here the CTCR is 0.39 and the CTAR is 0.15. It is suggestive of grossly increased lung size as compared to fetal heart size. Now we proceed to the fetal echo. You can see the heart, the 4-chamber heart is clearly visible. You can see this is the left ventricle, this is the right ventricle, left atrium and right atrium. Now you can see in heart, these are the entering pulmonary vein. So we can rule out total anomalous pulmonary venous connection. This is, as we proceed toward the left ventricular outflow tract, you can see the LVOT is visible. Now as we proceed, you can see the RVOT, the right pulmonary artery and the left pulmonary artery. These are clearly seen dividing arising from right ventricle. Now this is the aorta and this is the SVC. This is a 3 vessel view. So it is appearing normal. Now we have a very good finding here. You can see when we apply the color Doppler, you can see a vessel arising from the base of junction of the aortic arch and the ductal arch. Can you name this? What is this? This is aberrant right subclavian artery. It is a very good finding and it is a rare finding. Aberrant right subclavian artery is seen in the fetuses with abnormality, and in these most likely the fetus is with Down syndrome, and in this fetus we are getting an additional structural abnormality, which is the brightly echogenic left lung. The left lung volume is grossly increased. As I will take the volume so that you can see what is the volume here. As compared to the normal lung volume, the volume is increased. It is around 18 cc. So it is quite large as compared to the normal fetuses of the same gestational age. Now to confirm the diagnosis, what you can see suggests the diagnosis of this bright echogenic lung. Mostly if the condition is bilateral, then the diagnosis is likely congenital high airway obstruction. So can we see that? We can look for the trachea in this condition. Yeah, you can clearly see the trachea here. This is the fetal head and this is the dilated trachea. Sorry. Yeah. As you can see clearly, this is the tracheal dilatation. A blind pouch is formed because of the tracheal dilatation, likely suggesting the possibility of congenital high airway obstruction, which we call as KOS. It is the likely diagnosis. But in this case, as we can see, only one lung is enlarged. The other lung echogenicity appear absolutely normal. So what are the other differential diagnoses? So in this case, you can see the brightly echogenic lung